Welcome to today's webinar, Using the Community Guide for Community Health Improvement. I'm Ron Bialik, President of the Public Health Foundation, and I am the moderator for today's webinar. For those of you who may not be familiar with the Public Health Foundation, our mission is to improve the public's health by strengthening the quality and performance of public health practice. We provide a variety of tools and training and technical assistance in the areas of quality improvement, performance management, and workforce development to help health departments, hospitals, and other community organizations improve performance to help them better meet their community population health needs. We have a couple of housekeeping items before we get going. First, we ask that if you're using your phone for audio, please enter your PIN if you've not already done so. Your unique PIN is found in the participant control panel in the upper right-hand corner of your screen. If you don't see the participant panel, you can click on the orange arrow and that will open it up. That same orange arrow, if you click on it, will also close the participant panel. Second, the slides for today's webinar can be downloaded by clicking on the file name in the handouts section of the participant panel control panel. A number of the slides today have hyperlinks embedded in them, and if you wish to use those hyperlinks after the presentation, if you download the slides, you'll be able to access them after the webinar. Third, because we have 500 participants today, and we'll have all of the participants' lines muted throughout the webinar, because of that, all questions and comments should be submitted through the questions section of the participant panel. Finally, we are recording today's webinar and it will be archived. The archived webinar, as well as answers to questions that we're unable to answer due to time constraints today, those will be distributed to all of those who registered for today's webinar. During today's webinar, we will be describing ways that the Guide to Community Preventive Services can be used by a variety of community stakeholders to address priority community health improvement needs. We also will be discussing tools that are being developed to help hospitals and health systems integrate evidence-based strategies and interventions into their community health improvement plans and actions. And finally, we'll be introducing you to a pilot initiative involving 2 hospitals and their community partners that will demonstrate how the community guide can be used to address priority population health needs. Now I'd like to take a moment to introduce our speakers. We're quite pleased to have 3 very dynamic, informative, wonderful speakers with us today. We have Shauna Mercer, who is the Chief of the Community Guide Branch at the Centers for Disease Control and Prevention. And Shauna will be talking with us today about the Community Guide and how it can be used by hospitals, health systems, health departments, and a variety of other community organizations to address community health improvement planning and to take action steps using evidence-based strategies and interventions. We also have with us Katja Seligman, who is a program manager with the Health Research and Educational Trust, which is an arm of the American Hospital Association. Katja will be talking with us about a tool under development that can assist hospitals, health systems, and others move from assessing community health needs to implementing strategies to address identified needs. And finally, we'll be hearing from Jack Moran. Jack is the Senior Quality Advisor at the Public Health Foundation. And Jack will be talking with us today about the Population Health Driver Diagram framework that will be used as a key tool in the pilot with 2 hospitals in their communities. And within these communities, we'll be identifying and implementing, or the communities will be identifying and implementing actions to address priority population health needs. Shauna, so let me turn this over to you so you can talk with us about the Community Guide.
Hi there. Welcome to everybody. It's great to have this opportunity to talk with you today. What I would like to do today is to talk about how the Community Guide can actually help many of you with devising various implementation strategies that you need to develop as part of community benefit requirements, and for others of you who are putting together plans, either improvement plans or other plans to help with the needs of your community. Next slide, please. And go to the next slide, please. There are 4 the various areas that I'm going to be talking to you about today. The first is to talk to you about what's driving the current focus both on population health in a big way and also on community health improvement. Second, I'll talk about what's the value of using an evidence-based approach when you're trying to select interventions to help with community health improvement activities. Thirdly, I'll talk to you about the community guide and how it provides a very helpful evidence base for public health. And fourthly, I'd like to leave you with a touch of navigating the community guide website so you can go and find resources yourself. Next slide, please. So let's start by talking about what's driving this current focus on community health improvement. Next slide, please. So many of you are aware, at least the hospital side and many of our health departments are aware, that at the current time, as part of the Affordable Care Act or as a result of the Affordable Care Act, the Internal Revenue Service is now requiring charitable 501c3 hospitals who wish to keep their tax-exempt status to actually, they are required now to conduct a community health needs assessment at least once every 3 years. And then after they've developed the community health needs assessment, they are to put together implementation strategies that address some of the community health needs they found through their assessment. And in addition, they are in themselves, the hospitals must define their communities to include the people in the geographic area from which they draw their patients that are low income, medically underserved, and minority, as well as all others in their areas. Next slide. Other things that are important as part of the IRS are that the community health needs assessments and implementation strategies must be made widely available to the public. And also that for all tax years from this one forward, the hospitals must have an impact evaluation of the actions that they have taken and that were identified in their needs assessment. Now, the American Hospital Association and others have come up with some very helpful guidance for working through the community benefit process and reporting. In a number of these guides, though, at the current time, there is less information on where to find effective strategies that can meet the identified health needs of the hospitals. Next slide. This is particularly challenging because many hospitals are used to working in tertiary prevention. And what we need to do as part of working in the community is move towards secondary and primary prevention. Secondary prevention, such things as screening, primary prevention, things like preventing obesity. These are big challenges for all of us. Next slide. So what are the other important community health drivers at the current time? Well, a number of you may also know that there is a process afoot right now to accredit all public health departments in the country on a voluntary basis. About half have been accredited so far, and as part of the accreditation process, the public health departments need to show that they can do community health and needs assessments, and they need to be able to identify effective strategies to meet the needs of their community. Others also are involved in community health needs assessment and identifying various other strategies. This includes federally qualified health centers. Healthy People 2020 and the National Prevention Strategies have set priorities for communities and states. A number of grants and grant-related activities are requiring community health needs assessments and or identifying evidence-based strategies to be used in communities. And many states also have requirements in these areas. Next slide, please. So what does this look like when you put it all together? Well, let's take the example of the area around Atlanta. And in this slide, the little blue dots with the circles in them or the crosses in them are hospitals in the Atlanta area. And the green is federally qualified health centers, and red is community health department clinics. You can already see the number of people who are co-located in this space, all trying to look at community health needs assessments and improvement activities. Slide, please. Now let's lay on top of that. Next slide, please. Let's lay on top of that health departments that are shown with their jurisdiction in this area, as well as some of the grant activities. And you start to see the large number of people, again, who are co-located in this space, often trying to get at the same people to figure out their needs and trying to solve them. So one of the most important things is for people to look at the resources around them and how they can work together to solve the needs that many of you have at this, that are very similar. Next slide, please. So all of you are trying, or many of you on the phone, are actually trying to go through this community health improvement planning process. And many of you, although you might have your own models according to your own backgrounds, they have, in general, the same basic steps. The first step is to identify what the problems are in your community, the assessment itself. Then to set objectives. What is it we want to achieve? And that may be state-level objectives, local objectives, or objectives that might come from something like the Healthy People 2020 initiative. The next stage is to identify what works to allow us to set these objectives for the problems that we have. And then how do we do this? How do we implement things in our community? And then finally, we have to evaluate what we've done. The community guide fits in both helping you identify what works, it's a source of interventions, and then increasingly, how do you do this with implementation assistance being provided? Next slide, please. So what is the value of using an evidence-based approach to select interventions? Next slide, please. There are many different sources of evidence that people can turn to in public health and also in healthcare. People can just try to come up with something and say we have to do something. They can talk to others to find out what they're doing, or they can read a report about what a particular group did. But their situation and setting may be very different from the setting of the person that they speak to or the report that they read about. A little bit more formal identification can be in a written up evaluation of a study or program, but once again, often you have only one setting and you might wonder if this would work in your own community. This is why people pull together different studies or programs and try to see across those, do you see the same thing? And so systematic reviews are a form of evidence that looks across studies and programs and tries to determine, have we seen similar things across all of these settings? Next slide, please. So why is it helpful to use an evidence-based approach, like by using systematic reviews or other things? Because programs and services and policies that have been designated as evidence-based are approaches that have been found across these various settings to be effective, and that might help you identify that you would have a stronger likelihood of the same kinds of effects in your own community or state. Evidence-based approaches therefore allow your resources to be used wisely, especially when they're scarce. Many funders are actually requiring the use of evidence-based programs. And also, if you can use an evidence-based program, service, or policy, it can shorten the amount of time it takes for you to get to the interventions you are going to use. Next slide, please. So how does the community guide fit into all of this as an important evidence base for public health? Next slide. Let's start by identifying what the community guide is. The community guide is short for the Guide to Community Preventive Services, and it consists of two things. The first is systematic reviews, as I spoke about before, of all of the available evidence on the effectiveness of a wide range of community-based programs, services, and policies, and also systematic reviews of the economic benefit of those programs, services, and policies, and also identifying gaps where we still do not have evidence. And then a second thing, these systematic reviews are used as the basis of evidence-based findings and recommendations that identify which programs, services, and policies are effective. And these are used not to tell people what to do, but to help inform their decision-making. These recommendations and findings are developed by the Community Preventive Services Task Force. Next slide, please. So who is this task force? Well, it is a statutorily mandated, non-federal, independent rotating panel that is got experts on it from a wide range of research, practice, and policy settings. They have to have involvement in all three of those areas. Members are nominated through a process that includes broad input throughout the public health and healthcare settings, and the members are appointed by the CDC director, and they do not get any compensation at all so that they can maintain their independence from the federal government. And CDC is also statutorily mandated to provide support to the task force, and I lead the staff that provide that support. Next slide, please. Many of you, especially those of you in healthcare areas, may be familiar with the U.S. Preventive Services Task Force. The U.S. Preventive Services Task Force and the Community Preventive Services Task Forces are sister task forces. The U.S. Preventive Services Task Force primarily looks at the effectiveness of interventions that can be delivered by primary care clinicians or others working in that same area. And it looks at the effectiveness of things like screening tests, preventive medications, and behavior change counseling. The Community Preventive Services Task Force looks at other things in the health area. Let's move to the next slide and I'll provide some examples and lay this out for you. So there are basically 4 areas of community preventive services, all 4 of which the Community Guide works in. The first is looking at the effectiveness of informational and educational interventions, like, is it effective to send newsletters or videos out to people to see if we can get more of them to come in to get screened for colorectal cancer? Or can we provide training programs to staff that serve alcohol, and is that going to help reduce excessive alcohol consumption and related harms if that's a problem in our communities? The second area is behavioral and social programs. And the task force has looked at things like, what is the effectiveness of combined diet and physical activity promotion programs in preventing type 2 diabetes among people who are at increased risk? Or what is the effectiveness of behavioral interventions that try to get people to spend less time in front of a screen in a sedentary position, and does this improve their physical activity and their diet? Next slide, please. There are 2 other areas of community preventive services. So the third of all of them so far is environmental and policy interventions. Such things as, what's the effectiveness of changing a street, adding lighting, and making it safer to walk? Does that increase physical activity in a community? What's the effectiveness of having bans and restrictions on smoking? Does that reduce exposure to environmental tobacco smoke? And the last area that the task force looks at is the effectiveness of health system interventions. That may be public health system or health care system interventions. Like, what's the effectiveness of having a collaborative approach to manage depressive disorders? Or if we engage community health workers in our system, can we prevent cardiovascular disease and prevent fewer people arriving at the hospital with issues? Next slide, please. So the task force works in all of these areas, and so far it has approximately 220 findings. And this slide shows the number of conditions that the task force has worked in, the different risk behaviors that they have looked at effective interventions for various settings, and all of those in blue are where we are currently doing reviews. Next slide, please. As we're waiting for the next slide, I just want to highlight here that the U.S. Preventive Services Task Force that I identified earlier, the U.S. Preventive Services Task Force, their recommendations, A and B recommendations, are mandated for coverage. The Community Preventive Services Task Force recommendations are not mandates. Instead, they are options, and this is because every setting and situation and community may be very different in what it needs and in its available resources. And there are lots of different types of communities and workplaces and businesses that come to the Community Guide. So what the Community Guide does is, instead of providing mandates, it provides menus of options for which we have determined the effectiveness, and various users can come and say, do any of these fit my current needs, preferences, priorities, and available resources? Next slide, please. So what are all the different ways that people use the Community Guide? Well, we have talked to our users, and there are many different things. So some people use it to develop policies in their community. Other people use it to develop a program strategy, the 2 purple boxes on the left-hand side. But there are many other things that people do. Some people actually take the Community Guide when they want to mobilize their community and say, look, here are problems and here are some effective solutions that we could choose between to see if any of these work for us. Other people use it to plan individual programs or to help plan all of the approaches that they are doing at a particular time. Some people use it to justify, please don't cut my program. We need the resources for this, and look, there's evidence behind this that it is effective. Many people use it to foster dialogue among community members about how they can tackle problems in their community. Next slide, please. We also engage users in actually developing the Community Guide itself. And this is because we need to make sure that the recommendations we are coming with actually make sense to and will fit with what is going on in the real world across the United States. So toward that end, we have more than 30 federal agency and organizational liaisons that include many federal systems, organizations that support public health agencies like the Public Health Foundation and the American Public Health Association, and then many healthcare-related organizations like the American Academy of Family Physicians, the American Medical Association, nursing groups, and others. And all of these liaisons sit with the task force, provide input into their topic prioritization. As they deliberate through their findings and recommendations, they help them identify what this is going to look like in the community and for their constituents. And then they help in disseminating and translating the information for their particular constituent group. We also include users on all of the individual systematic reviews. Teams of people do these reviews, and we need people from policy and practice settings to help make sure we are asking the right questions. Next slide, please. So this infographic just shows very briefly what we do in those reviews, and I'm just going to highlight on the black text now. Those of you who get the slides and would like more detail can go back and look at this more closely later. The first thing the task force does is prioritize topic areas for review. Next, it conducts the evidence-based review, that systematic review I talked about, both a systematic review of effectiveness and also economic information. And then finally, the task force makes a recommendation. Next slide. So what is it the task force is actually looking at? Next slide, please. The task force is seeking to answer a number of questions. Of course, we want to know whether an intervention works, but not just that, how well? And does it work for different groups of people, different racial ethnic groups, different people, urban, rural? And under what circumstances are these things appropriate? Is it applicable in a wide range of settings and situations? Really importantly, how much do these things cost? Do they provide value? Are there any barriers that people could come across in trying to use them? Are there any harms? And might there be any unanticipated consequences? Next slide. The task force puts all of this information together and comes up with one of three findings. It can either recommend an intervention on the basis of strong or sufficient evidence, recommend against for the same reasons, or it can say, at the current time, we don't have enough evidence to recommend for or against it because there's insufficient evidence. That doesn't mean it doesn't work. It means that we don't know, and you all may be very helpful to us in learning whether it works or not in the future. Next slide, please. So what do you do if you see the community guide has a recommendation? The recommendation, an evidence-based recommendation from the task force, is not a cookbook solution. It actually requires looking to see, we put together the information on how effective something is and whether there is value from a cost perspective. And then the community or state or hospital can look at what are the needs that we have identified in our needs assessment, what are the capacities we have, what kind of funding and resources do we have available, and this information together can help decide what's best for a community. Next slide, please. If you actually look at something in the guide and you get an insufficient evidence finding, then what do? Well, let's say you're using the intervention currently in the community. If there aren't any associated harms, you may choose to continue using it, especially if it works well with other things, or you may choose to stop using it if it's expensive and move to something where there is more evidence. If you haven't yet come to something, you may want to go to an area where there is better evidence, or you may say in a funding proposal, for example, this is something that may work well in our community and we want to build the evidence base by evaluation. So if you actually do undertake an innovation in your community, please try to collect data and provide it back to us and others so that you can help contribute to the evidence base and fill in those gaps. Next slide, please. The last thing I want to highlight, and then I'm just going to quickly go through the web for you, is that what the community guide does is not identify effective programs. Does a particular program that looks exactly like this work? And that is because a program developed for one setting may or may not translate to another setting. What the community guide does is say, what do strategies that a number of programs may be examples of, do they work? There is value in doing that, because if a strategy works across different settings and situations, then if you have a situation where you may need to modify something a little but you fit within the broader rubric, you are more likely to have confidence that that is going to work in your community. So we identify strategies. Next step, slide please. But those strategies still need to be interpreted into a program. And so the community guide highlights packaged programs that are available for many of our interventions. And this slide identifies other sources of information. Let's move to the next slide, please. Here are 3 sources of packaged programs that you all may want to look at when you identify an effective strategy and then want to say, what is this going to look like exactly in my community? Give me a program where I can have tools to use and posters and whatever else is necessary. Next slide. I'm just going to finish by showing you the Community Guide website very quickly. Next slide, please. This is the current Community Guide website, and I'd like to highlight right now that you can just look at task force findings identified with an arrow at the top, or click on topics and look at things at any time. But we would really encourage you to check out our new Community Guide website that's in beta and identified on the right now, and will be the only source of our Community Guide website in a few months. Next slide. This new website this is what it is going to look like. This is a learning system, a website that actually brings information to you that is more of what you yourself want. And so I've highlighted the arrow down below. If you want to navigate the site and have any questions about how to do it, you can click here and get information. At the top, one of the most valuable things you can do is register and get information fed to you that is related to your interests. So anybody going on the system will see the things that are most viewed. Next slide. If you actually register, you will be asked to create an account. No one checks up on you, but you can put in here information about yourself, what kind of business you're in. Let's go to the next slide. The information that you are interested in, what topics are you interested in, where do you work, etc. And that will allow you to create an account so that every other time you come back, you will get information specific to you. Next slide. So if you come in at one point and you are interested in diabetes, you will identify topics and then all of the information that comes up, the latest task force findings for diabetes. Next slide, please. Let's say you click in that search term, diabetes, diet, physical activity, or let's say you even put in activity or physical fitness. This is a smart search, so it will come up with terms that will allow you to find things that are of interest to you. It knows when you say physical fitness that physical activity is related. When you put these things in the search term, you'll come up with a whole list of things that the guide has available. You can sort, as it shows on the left, by what's of interest to you. And if you look at the orange bar at the top, you can see that there are 161 reviews that relate that you may get information on. In action, the next slide at the top, if you were to click there, gives you stories. Nope, I'm sorry, back to, I'm showing the top. I'm sorry, the in action at the top. This is stories of other communities and businesses and how they have used the guide and the effects that they have found. Tools, you can go to find tools that may help you implement something in your community, and resources, things to help you understand and learn about implementation in your community. Next slide, please. Here, it's just, if you were to click on one of those interventions, this gives you an example of what you will see. You will see a summary of the Community Guide review, a snapshot, then you can go into more detail on what the task force found, various materials, considerations for implementation, and the arrows down the side. You can click each of these to expand and get more information, or summarize it and only look at what you're interested in. And at the top in circle, I've highlighted that you can print this and only print out the information that you are interested in and not the things you are not. Next slide, please. The last thing, just in closing, we are collecting Community Guide in action stories, and I've shown you where you can go on the website to find stories of how other people have been using the Community Guide. Many of these we've collected with the Public Health Foundation, our sponsor on this call. Next slide. We would like to actually have Community Guide in action stories for all settings and situations across all of the states. and we are particularly interested in stories of how hospitals are using the community guide. If any of you have, please consider submitting your stories. We have people that can work with you on developing them, and then hopefully they could reside on our website and be available to you. Next slide. I'd like to end by thanking you for your attention. And I'd like to turn it now over to Katja, who will talk to you about the tools that the American Hospital Association has developed.
Thank you so much, Shauna, and thank you for that wonderful and informative presentation. As Shauna mentioned, my name is Katja Seligman. I'm a program manager here at the Health Research and Educational Trust, as well as the Association for Community Health Improvement. I'm going to be talking today about how the community guide is important and relevant specifically for the work of hospitals, as well as the resource that we are developing. Before I share more about that, I first wanted to share a bit about our organization. So the Health Research and Educational Trust, or HRET, was established in 1944 and is a nonprofit affiliate of the American Hospital Association. We currently have more than 20 active projects and 80 FTEs. And for these projects, we partner with a number of organizations, including federal agencies such as CDC, AHRQ, and CMS, private foundations such as the Robert Wood Johnson Foundation, other organizations such as PHS, and of course, hospitals. We also have the Hospitals in Pursuit of Excellence, which offers best practice sharing, action guides and reports, a fellowship program, and numerous other initiatives related to national improvement projects. The vision of HRET is leveraging research and education to create a society of healthy communities where all individuals reach their highest potential for health. And our mission is transforming healthcare through research and education. Next slide, please. The Association for Community Health Improvement, or ACHI, is a personal membership group of the American Hospital Association and a division of HRET. ACHI was established in 2003, and the vision is to cultivate a society of professionals who apply their specialized knowledge and expertise to effectively educate and collaborate with their communities in achieving the highest potential for health for their residents. The mission is to advance healthy communities by providing members education, professional development, resources, and engagement opportunities in the fields of community health, population health, and community benefits. Next slide, please. We previously partnered with the CDC and PHS on a webinar on this topic in 2013. During this webinar, we shared a few examples of how hospitals are utilizing the community guide. In particular, we highlighted a health institute and 2 health systems in Akron, Ohio, which used the community guide as a resource for best practices specifically related to a multi-site diabetes program. These organizations were Austin Bioinnovation Institute, Akron General Health System, and Summa Health System. And they used the community guide to incorporate educational and experience modules and to influence behavior changes to lead to increased self-management skills and improved communication with their care providers. To further support hospitals to utilize the community guide, HRET and ACHI are currently working to develop and revise tools for the field, specifically relating to community health needs assessments. Next slide, please. As Shauna highlighted, and as I'm sure many of you are familiar, with the passage of the ACA, all nonprofits in the U.S. are required to conduct community health needs assessments every 3 years. This includes needs assessment, reviewing quantitative data on community health status, soliciting input of community stakeholders, selecting priority health needs, and devising strategies and implementation plans to address these priority needs. We found that the community guide is an extremely helpful resource for hospitals and community organizations who are working to implement strategies and interventions to address the needs that they have prioritized. In particular, the ability to search by topic allows users to easily identify existing programs, resources, and research that they can use to improve the health of their communities. Next slide, please. ACHI has previously created the Community Health Assessment Toolkit, and this is a guide for planning, leading, and using CHNAs to better understand and improve the health of communities. The toolkit has numerous advantages. First, it's a detailed and structured approach to conducting CHNAs and the subsequent implementation plans. Second, it advocates for a collaborative approach with the community. Third, it addresses social determinants of health. And fourth, it's applicable to healthcare and public health organizations alike. We're currently in the process of developing the next iteration of the toolkit, or version 2.0. Version 2.0 will include not just the assessment portion of CHNAs, but also the implementation portion. And for this new version, we're going to be incorporating the community guide, as there's a very clear alignment between this toolkit and the work of the community guide. For example, the community guide topics are very closely aligned with those common topics that CHNA developers are prioritizing. The community guide also helps hospitals identify evidence-based strategies to address their health needs. And finally, the community guide provides a framework for a collaborative intervention approach. For this process, we are convening a work group of a diverse range of experts in the field. This work group is working together to update the resources that we currently have. We're also updating the website that hosts this toolkit, and we're going to be migrating it over to the ACHI website, which is healthycommunities.org. And finally, we're going to be making this publicly available. Currently, it is a members-only resource, but we see the value of opening it up to the larger field. Next slide, please. So far, for this new version of the toolkit, we've updated a model, which you can see here. And this includes not just the assessment, but as we've been speaking about today, also the implementation steps that can be used for improvement strategies. So you can see here that the model has 8 steps, starting from identifying and engaging stakeholders and going all the way through evaluating progress. And this really is an ongoing process. You'll also notice that we've identified engaging community members and patients at the center of this process, and that they should be involved in every single step of this model. The process will also really encourage hospitals to utilize the community guide as their guiding principles for their collaborative implementation strategies. In addition to the toolkit, we're also communicating with hospitals about the community guide in general and collaborating on a couple of webinars, including this one and one that's going to be coming at the end of the year. We're also extremely excited to be partnering on a pilot protocol that can be used by hospitals as they work on their improvement plans and work with community partners. So I'll turn it back over to Ron, who will share more about this pilot testing project. Ron?
Thank you very much, Katya. As we heard from Shauna and Katya, there are wonderful resources that can help hospitals, health systems, health departments, and other organizations identify evidence-based strategies and interventions for addressing population health needs. The pilot initiative that CDC is sponsoring will enable us to work with 2 hospitals and their communities to demonstrate how recommendations and strategies from the community guide can be used to take action to improve the health of communities. The anchor or lead institutions for our 2 pilot sites are WellSpan Health in York, Pennsylvania, and Integris Health in Oklahoma City. At both sites, a priority population health need identified in the hospital's community health needs assessment or community health improvement plan will be addressed. Along with the hospital, the health department and other community stakeholders will be engaged in improvement activities to address the priority population health need. Evidence-based interventions and strategies from the community guide will be identified and actions will be taken to implement these interventions and strategies. A key tool and the framework that we'll be using in both of these communities is the population health driver diagram. This framework helps to identify and align actions to address population health priorities. Jack will now talk with us about the population health driver diagram framework and its uses. Jack?
Well, thank you. And for those of you that are maybe new to the population health driver diagram, it's been around for a long time. When I was running a hospital many years ago, around 2000, we started using it inside the hospital to focus on things like reducing patient falls or how to expand our OR. But then one time we actually went outside the hospital and worked with our community to see how we could improve our community relationships. And so it was both an internal and an external focus. So one of the things you'll see is what is a population health diagram. Go ahead. You know, it's really used to identify what really drives the system, some primary or secondary drivers of an improvement project. Go ahead. And again, it's a framework. It looks at the actions you're going to do. It looks across multiple disciplines. And how are we really going to align those things to make sure that we achieve the community health objective that we want? Again, it really relies on collaboration rather than competitiveness. and really grounded in the belief that if we work together and combine our efforts to address a health issue, we will do better than we would if we did it separately. And again, it really focuses where public health and healthcare comes together. We were part of a CDC initiative back a while ago where we were working with 8 hospitals to reduce antibiotic usage, and our part, PHF, was to bring this over to the public health side. And we've done that. So we've really found that it really helps to reduce the silo effect. Go ahead. So you'll see here, again, the tool shows many potential change processes across many sectors. Look at the relationship. It always is tied back to an aim or a goal. And again, we want to make sure that everything we do, whether it's a primary or secondary driver, are related. And they're all going back to how do we achieve our aim and our goal. And again, a guide for the community health improvement team to appropriate action take to achieve their aim. And helps the team have a shared view of the theory of change in a system. When you see it visually, it's very easy to start to see how is this all going to come together in the process. Go ahead. Again, what does the driver diagram represent? Well, it really represents the team members' thinking. And it really talks about cause and effect in the system. And we're really thinking about what changes will likely cause the desired effects. So this is where the community guide comes in and helps us evaluate some of these as we're looking at it. Gives us a rich source of information to really focus on cause and effect. And again, we want to start now talking about how. How are we going to do this as we move forward? Go ahead. And again, we're really looking at what aspects of the system we should measure and be monitoring, because this is a key part of this is we just don't start doing this. We really want to understand what we're doing, where we're starting from, and what change we've made. Did we move the needle in this process? And again, population health driver diagram, has the following components: an aim. What are we going to do? What are the goals? And then what drives those goals primarily? And then what are the secondary drivers of those primary drivers? And you'll see as we go forward in this, we have a diagram that will show you that. Go ahead. And again, when you think about this, we're really starting up at the aim at about 50,000 feet. It's a broad statement. We come down a little bit lower to the goals. Again, we're getting a 30,000 foot view. We get a little more specific with the primary drivers, and the secondary drivers get us down close to action, but the secondary drivers, when we start to focus on them, really spawn the improvement projects that will really get the action going in the system. Go ahead. Here's one we developed in our antibiotic use, and how could we reduce antibiotic use in the community. And again, you can see in this case we had some primary drivers. We usually have 3 to 4, and we had some secondary drivers. Now, when it's done, it looks simple. It looks like, it's pretty obvious. We could have done this right at the beginning. But it takes time and dedication. You got to get a group of people together who are subject matter experts, who can really understand the problem, agree on the aim, and then really get the goals in place, and then develop the primary and secondary drivers. Go ahead. Again, we have a 16-step process. Now, it doesn't mean we're going to use every one of the steps. If you were starting from dead scratch, this is what the process would look like. Go ahead. And a key part of what we tell people to do is start small in this process, think big, and then scale it up quickly with multiple PDA cycles. Again, we want to come up with metrics. Key thing, get a baseline. We've got to know where we're starting from. Make sure the improvement goals can be measured, and then have a timeline, things we can accomplish on a regular basis. And then as we're going along, we like to think about the near term, but also start to be thinking about the mid to long term. What are we really going to change down there? And these small interventions we start in the near term really get us focused on those mid to long term changes. And once you get clear objectives, strategy-led initiatives move very quickly, and they progress fast in this case. Go ahead. So, as I always tell people, it was easy, we'd be done by now, but it takes a lot of time to do this. Go ahead. So the 16 steps we have, really, part of it is when we start brand new with an organization, we have pre-work we do. We have a set of things they need to do. Again, we need to really define the aim of the community health issue. And a couple of steps are optional. Sometimes we've developed guiding principles of the initiative. things people think are really key to this process, and make sure that they have focus throughout the driver diagram. Again, when we want to know what's going on in my backyard, especially when we have a collaboration of community partners, healthcare, public health, what are we all doing? And it's usually interesting, this exercise, when we do it with a group, is that a lot of people don't know what's going on in their backyard. I might be doing the same thing that you're doing. Or we might be doing things that are cross purposes, but it's a good way to get it moving forward. We understand the cost of the issue before we get started. Then we look at the things we talked about, the aim, the secondary drivers, and then we need to have team leads, people who can make this happen, get it into action. What are the partners going to do? If you come into this with some contracts and some commitments, things you're agreeing to. And then when we get groups in to review it, we use a process with an add, change, and agree matrix, and we do some round-robin input processes where we make the driver diagram more robust. Then we start to focus on where are we going to do some action. And then we make sure, before we jump into action, that if I'm in primary driver 1 and I have an action, and my secondary driver I'm doing, is it similar to one in primary driver 3? Want to make sure we're not overlapping in this case. Go ahead. And then what we want to do is, how do we develop the action areas? How are we going to get things to implement? Key part is measurement. And then we want to trial it. So we may have an idea to improve something in a clinic, in the in the community. So try it in one clinic, see how it works. Then if it works, we can expand it to other areas and finalize it. Go ahead. So again, with the driver diagram, the outcome is the aim statement, and you really need to be clear and concise. The broader it is, the harder it is to narrow down the driver diagram. Primary drivers, we've talked about those. These are the key things. They got to be addressed to get the desired outcome. And then for secondary drivers are really specific areas. We're going to think of making changes in this case. And the secondary drivers got to contribute to at least one primary driver. Go ahead. So this is what it looks like. We have an aim, we have goals, primary drivers, secondary drivers. You have 3 or 4 primary drivers, and then a group of secondary drivers. And again, as we go through this, a lot of this is a process of prioritization. Good. And again, this is where the community guide comes in, because it's rich and it's full of information that we can go in and look and say, whatever we're dealing with in this case, if it's behavioral health, there's a number of things they talk about. And we can see many primary and secondary drivers that we may use in this case. And we can find other information that can help the project teams as we go forward. Go ahead. Go ahead. Let's skip that one. And again, this is one where we're saying preventing obesity in adults, children, and adolescents. Very broad aim statement. You may want to do it down, you might say just obesity in adults or in children or in adolescents. If you mix too much in, they may be across purposes to each other. So when you do the aim, it's really time to really make it specific. And we go back and forth on this because we'll look at the aim, we'll develop some goals. Some of the goals may be more specific. We have to reduce the aim a little bit and make it a little more specific. And the same thing when you get to the primary drivers in this case. Go ahead. So one of the things we start, as I said, we start small, think big, and scale fast. Sometimes when we start off, we have hunches. We have the theories from community guides. We have ideas that we know about, that we've heard other people talk about. So we do the PDCA cycle, very small scale tests, follow-up tests, wider scale tests. And then you can see at the top, instead of being PDCA, it becomes plan, do, plan, check, standardize, and then act in this case. So we get it in, we have a change package in this case, and we standardize it. And then we hope at this point we're seeing some changes that have moved the needle from our baseline data in the direction that we wanted it to go. But again, it's really doing some small scale tests first and then continually increasing the rate and rapid amount that we're doing so that we scale fast and then get the primary improvement that we want, and then we have an implementation change package. Okay, one more. And again, we talk to people about driver diagrams and living documents. You got to modify them as you go along, and as we're learning, something we had may not work. And as it evolves, it helps us capture the learning. So when we finish, we have one that is, more or less the current thinking of the team that is working on some evidence-based strategies. And one thing you realize as you drive a diagram, you could spend the rest of your life making one because it never gets done. It's always a living document. So we get to a point where we say, let's go and implement. Now as we're doing it, we can keep updating it. So it is a living document that continues to evolve. Okay, next slide. I'll turn it back over to Ron.
Thank you very much, Jack. If you'd like to know more about population health driver diagrams, please visit the Public Health Foundation's website. On our website, we have the Institute of Medicine discussion paper on the population health driver diagram, as well as several driver diagrams that have been used in a variety of settings. And as a reminder, there are hyperlinks embedded into the slides. If you download the slide from the handout section in the control panel, you'll be able to use the slides and the hyperlinks within them. Also, I'd like to mention the Public Health Foundation provides on-site technical assistance and can work with your community to develop and implement a population health driver diagram to address your community's population health needs. You can read more about this on our website, or feel free to contact Margie Beaudry, our Associate Director for Performance Improvement Services. In addition, we provide a variety of performance improvement services for hospitals, health departments, and community organizations on-site to help meet your specific needs. And again, there's a hyperlink there, or feel free to contact Margie. So now it's time for your questions and our answers to your questions. And we see that there is a question. And Janelle, will you read that, please?
Absolutely. So we have a question: can I enter an activity such as farmers market and find out if it is a recommended strategy?
So Shauna, that sounds like for you. Yes. It is for you, Shauna.
That is a really good question, and I'm going to go try it out myself on our beta site. A farmer's market would be related to some of the nutrition and obesity reviews that we have done. I am not sure at the current time whether we have a review that has addressed farmer's market. We are in the middle of updating and developing a bunch of new reviews in the area of obesity and nutrition. And so that's a very good question. I'll have to go back and check myself whether farmers market will get you to obesity. That specific intervention, I'm going to continue to look in the background, but I would say that specific intervention is not currently in the community guide, but we are working on new interventions in the area of obesity, prevention and control, and nutrition.
Thank you, Shauna. And just as a reminder, you can type your questions in the question box in the control panel. Looked like there was a comment looking more specifically, or I guess narrowing down, Shauna, to urban farmer markets. So I guess if you can look for either farmers markets in general and urban farmer markets more specifically, that would be helpful. Are there other questions?
And if I could just, was that me with feedback there? Sorry if it was. The area of obesity and nutrition has been a very hard one for many of us to move into because a number of studies that were done were struggling over trying to figure out what were effective interventions and then what should we be measuring as outcomes. Much of that work has been done in recent years, and there's just an explosion of evidence. We are right now doing a review that will be brought to the task force in June, looking at school-based environmental and policy interventions for reducing obesity, also have some effect on physical activity and nutrition. And there are, I think, close to 100 different studies that we are looking at. So there's a lot of evidence, and there will be more reviews coming in that area. Ron, if there's not another question, Roy had made a comment earlier that I think is a really important one, and when it's an appropriate time, I would love to respond to his really good comment.
And Shauna, there are a couple of other questions.
Please go ahead.
So Daniel says he doesn't see overdose or suicide prevention in the topics. Will those be added? And what about stigma reduction?
Yes, the areas of overdose and suicide prevention are among the high priority areas that the task force has prioritized for the next set of its work. It's just done a reprioritization of its work for the next 5 to 10 years, and those areas are definitely among the highest priorities.
Thank you.
Stigma reduction. There are mental health and depression areas are of importance to the task force, and so stigma reduction as it might relate to those, yes, that topic or that intervention specifically for stigma reduction. The one area that you might look at now that might have some things related to stigma reduction would be those that relate to the school-based violence prevention programs. It would be under the violence prevention area of the guide. Reducing psychological harm from traumatic events, school-based violence prevention programs. Those kinds of things may have some related issues, but the areas of depression and mental health are very important for the task force.
Thank you, Shauna. We have another question, actually a couple. How are new community health topics identified for community guide review? For example, topics like opioid and prescription use are becoming community priorities and yet have not been reviewed. What is the timeline for new priority identification and review?
So the task force does 2 levels of prioritization of its work. The first is that approximately every 5 to 10 years or more as is necessary, it reprioritizes all of the work it does. And it does that in the area of topics. You might remember that I talked about menus of effective options. We try to do a few interventions in an area so people have choices. And so the task force, in its recent round of prioritization, collected information on the importance, the reach, community interest, all kinds of things for all of the topics in the Healthy People 2020 area, and got their liaisons and the public to provide input on what they felt were the most important priorities. They went forward with that information and came up with a priority order and ranking, or priority, their top ranked, middle ranked, and lower ranked. The areas that we have talked about, including overdose prevention, et cetera, these things are among the highest ranked areas for the task force. The other thing that the task force does is midterm reordering as necessary, and it can always take on a special project if that is considered of importance to the field.
We have time for one more question, but please continue to type in your questions. Our plan is to take the questions and to provide written answers and send that out with the archive to all of the people who registered for the webinar. Janelle?
Okay. I believe this is a question for Katja. What type of evaluation tools are being considered for the 2.0 toolkit being developed?
Thanks for that question. You know, we're actually just starting to think about the evaluation tools, so I don't have an answer to that just yet, but I'm happy to be in touch with whoever answered this question or put it up on the PHF website once we have more information.
Thank you so much, Katja. Again, please continue to type in your questions. We will be getting back to you on with answers to the questions. But next steps with regard to this activity, the set of activities that we've been talking about today, Katja and her colleagues at ACHI and HRET will continue their work on revising the assessment toolkit, and as Katja had mentioned earlier, looking to launch it later this year, and there'll be notices online, sent out through newsletters, etc. We plan to hold another webinar before the end of this calendar year that's focused on the accomplishments and lessons learned from the 2 pilot sites. We're really excited to be proceeding with our 2 sites. We also plan to continue making available resource materials that can help hospitals, health systems, health departments, and others in communities use the community guide to address population health priorities. If you'd like to stay informed about these and other resources, please sign up for the PHF e-news. This is a free e-newsletter, and it's distributed only about 10 times per year, so you don't have to worry about us cluttering your inboxes. Also, we have an upcoming webinar for those of you who may be interested in public health performance management. The webinar, Performance Management, Improving the Improvement, will be held on Thursday, April 21st at 12 Eastern Time. The Public Health Foundation also has a variety of online resources, and again, please feel free to surf our site a bit and see if you can find resources, training, tools, etc., that might meet your needs. And last but not least, we ask for your help. Your help in filling out the evaluation for today's webinar. Simply go to the question section of the participant panel, the control panel, and click on the link to the evaluation. Your evaluations help us improve what we do and will help us better meet your needs in the future through our other webinars. I want to thank our speakers today, Shauna Mercer, Katja Seligman, sorry Katja, and Jack Moran for their excellent and informative presentations. And most importantly, I thank you for your participation in today's webinar. Have a pleasant rest of your day. Thank you.